My name is Dr. Herman Bagga. I'm a urologist in the region. And today we're going to be talking about erectile dysfunction. We'll be going over what erectile dysfunction is, what causes it, and then, of course, most importantly, how do we deal with it? There's plenty of hope for erectile dysfunction. There's a lot of treatment options, and we'll make sure you're aware of those. We'll also go over some patient perspectives and talk about some additional resources they need properly taken care of. A little bit about myself. My name again is Dr. Herman Bagga. I'm a urologist in this region. I practice primarily in Sandy Springs, in Roswell, Alpharetta region, and then also in Cumming. Prior to starting up in Atlanta, I've been mostly in the Northeast. I was actually born and raised in New Jersey and then in Pennsylvania. And I did my training over at Johns Hopkins, which is where I did my medical school in Baltimore. I then went over to the West Coast to the University of California in San Francisco, where I trained in both general surgery, followed by urology. And then I did my fellowship at the Cleveland Clinic. My fellowship was directed in men's health, where I deal with a lot of erectile dysfunction, as well as penile prosthetics and advanced forms of erectile dysfunction, as well as reconstructive urology. I care for both male and female patients and in a wide variety of urology, but one of the things I do specialize in is men's health, erectile dysfunction, low testosterone, and other related issues to make sure men are taken care of in a more holistic fashion. Been in practice for quite a while, over a decade at this point, so we're happy to help you with some of the information we can provide today. Of course, standard disclaimer, we have to mention this is a nice educational resource. I hope and they can provide a lot of good information for you. But of course, when you're really getting your medical care, you want it to be individual, one-on-one with your physician so it can be personalized and appropriately tailored to your needs. A little bit of information about erectile dysfunction in general. What is erectile dysfunction? Really, erectile dysfunction is when a man cannot get an erection that they find to be suitable. It's really the simple definition right there. A man needs an erection that's firm enough and long-lasting enough for sexual intercourse. And if either of those two criteria are not fulfilled and a man's not happy with the result, that constitutes erectile dysfunction. Is it common? Unfortunately, yes. It is quite common. Over 30 million men in the United States are estimated to have erectile dysfunction, and it becomes particularly prominent after a man is in his 40s and above. Between age 40 to 70, it's estimated about 50% of men have some form of erectile dysfunction where they don't have an erection that they find to be suitable. It's a high number, so that can seem disheartening, but the good news is that it can be treated in the vast majority of cases. First, you got to think about what causes erectile dysfunction, right? I mean, ED is not, ED or erectile dysfunction, we abbreviate it as ED, is not a normal part of aging. I really don't accept the explanation that, oh, you're older, so you should have trouble with erections. That's simply not true. There are basic biological reasons why that can occur, and those may be more common with aging, but it's not simply aging that causes it. Erections require several processes to fully occur. I'm going to actually slip ahead a little bit just to tell how an erection occurs first, because I think it's important to know that before we can talk about some of the causes. So an erection occurs when the reservoirs, for lack of a better way to put it, they're called the corpora cavernosal bodies within the penis, fill up with blood. In some ways, it's like two water balloons that are in the penis. And when those fill up with blood, the penis gets strong, it gets firm, and it gets hard. And that's when you can get an erection. So the way an erection occurs is when those areas fill up with blood. That filling requires a few things to occur. Appropriate sexual stimulation with excitement. That causes the brain with the hormones that are released, the nerves, and the blood vessels to all work together. And unless they're all working together, you can't get a proper erection. What happens is the blood vessels open up in response to these stimuli. The blood rushes into the penis. You get a firm penis, and that's when you can have a sexual intercourse because you've obtained the erection. After you're done with erection, there's another series of events that occur, mandated first by a hormonal surge that causes the blood to get pushed out of the erection, and then the erection goes away. So there's a process for the erection to occur and then for it to go away. And it requires the coordination of three things: hormones, nerves, and blood vessels. All three of those have to be working together if you're going to have a proper erection. So then getting back to what causes erectile dysfunction, it's basically if any of those three aspects are not working properly. Sometimes it can be a hormonal problem. It could be low testosterone. And when there's a low testosterone level, it's hard to have a good libido, hard to have good sexual excitement, and then it becomes very difficult to get an erection. There are other hormonal sort of variables that can cause an issue as well. Sometimes there can be a unreasonably high number of stress hormones. So one thing that is mandatory to be able to get a good erection is you need to have low stress hormones at play. There's two nerve systems that are responsible for erections. One is the parasympathetic nervous system, and the second is the sympathetic nervous system. If the parasympathetic nervous system is revved up, that's like the on switch. If the sympathetic nervous system is revved up, that's the off switch. And the two of these are really working in congruence with one another to figure out whether there's on or an off signal to get an erection. There are certain hormones that will emulate the sympathetic nervous system, which is that off switch, and those are stress hormones. So when there's higher stress in the body, whether it be due to general anxiety, whether it be due to even performance pressure about not being able to get an erection, that's a stressful situation. Maybe it's physical stress, maybe you're not getting enough sleep, maybe there's relationship issues. All of these revs up that off signal as well, and as a result, there's an imbalance and it becomes difficult to get an erection. That's the stimulation of the nerves. So if there's a hormonal issue, whether it be related to stress hormones or to testosterone, that's one potential cause of erectile dysfunction. A second potential cause of erectile dysfunction is a direct nerve issue. Those nerves can sometimes get damaged. That can be seen in diabetes, sometimes in multiple sclerosis, Parkinson's, other forms of chronic diseases that can cause damage to the nerves themselves. And when that occurs, those nerves are unable to send a signal to tell the penis to open up those blood vessels to allow the blood to come in. So if there's a nerve problem, that's another reason why you may not be able to have a good erection. The third potential cause of erectile dysfunction is the most common, and that's what's referred to as vasculogenic erectile dysfunction. That's when the blood vessels themselves are diseased and they're not working well. The disease processes that happen to the blood vessels are called atherosclerosis with plaque formation. And what happens is those blood vessels start to get hardened and start to close off. So blood can't go through in the amount that it needs to allow the penis to open up for an erection. The words atherosclerosis, plaque formation may sound very familiar because those are the exact same processes that happen in the heart, which is something that is very commonly discussed. What we don't discuss is those exact same processes that occur in the heart and cause those blood vessels start to close off are the exact same ones that are happening in the penis, restricting blood flow to the penis and causing erectile dysfunction. That can happen due to lifestyle issues. Really, what I tell people is heart health is penis health. Penis health is heart health. So all the things you've heard about that can cause heart issues can also cause penile issues. Some of those are behavioral or lifestyle. So not having a good diet. So you want a heart healthy diet, high fiber, low cholesterol, low fat. That can make a big difference. You want to avoid smoking. You want to avoid too much alcohol. You want to make sure you're getting a good amount of cardiovascular exercise, at least 3 to 4 times a week, getting that heart rate up so you're maintaining those blood vessels. All of this is probably sounding pretty familiar because heart health is penis health, right? You want to make sure that you're working on good blood pressure control, make sure that there's not a high risk of diabetes. All of these things are cardiovascular risk factors, are also erectile dysfunction risk factors. Medications can cause it as well. Certain antihypertensives, meaning medications for blood pressure, are most commonly associated with erectile dysfunction. Also, a lot of medications used for depression, those also can cause erectile dysfunction. So when you go in to meet your physician and you talk about erectile dysfunction, those are really the three things that your physician should be looking into as potential causes. Number one, could there be a hormonal issue? Do we need to check a testosterone level? Are there certain stressors that are revving up that that sympathetic nervous system and making it difficult to get an erection? Number two, could there be any nerve issues? Do you have diabetes? Do you have any other of those diseases that can cause nerve damage? And number three, is there a blood vessel issue? So they're going to start to explore and ask questions that are related to heart health, exploring your medications to see if there are any that could be contributing as well. Those are the main causes of erectile dysfunction and how we try to evaluate a person. There's also the special case of a prostate removal. So unfortunately, prostate cancer is a pretty common cancer in the United States. It's one of the most common that's seen among men. One of the treatment options is surgical removal of the prostate. Another treatment option is radiation around the prostate. Unfortunately, both of those processes, while they're going to try to target the prostate and the prostate cancer inside, can also affect the nerves. So I do see a lot of men who have a history of prostate cancer and they have erectile dysfunction after successful treatment. Thankfully, that's the minority. The most common cause, once again, is vasculogenic or issues with the blood vessels. So how do you deal with erectile dysfunction? First of all, it's a very difficult thing to deal with. Not surprisingly, the majority of patients say that erectile dysfunction really negative impacts their quality of life. Number one, they're not able to have as much sexual intercourse as they would like. It really causes issues with self-confidence, not just with the erections, but just overall. You can also have loss of penile length. If you're not getting good erections, that means there's less blood flow to the penis. When there's less blood flow to any organ, that causes damage. There's fibrosis, and then that penis can start to lose length as well. It can really start to affect men, not just with their sexual life, but also psychologically. You can imagine it's a big deal, causes frustration, disappointment, and even anger. So it's very important that we are able to deal with erectile dysfunction in a more holistic fashion, not just deal with the erections themselves, but also deal with the person that's having the erectile dysfunction and make sure they're able to get past these issues. So then we get to the hope. So how do we deal with erectile dysfunction? The mainstay of therapy is often oral medications, right? The number one cause of erectile dysfunction is those blood vessels having disease and not being able to open up because of the atherosclerosis, those plaques, the hardening of the blood vessels. They can't expand to the point where the blood can properly pass. What these medications will do is they will help to have more blood flow going into those blood vessels, so it's easier for a man to get an erection. There are multiple medications that can be used for this. Viagra, Cialis, Levitra, Stendra are some of the most commonly used. I tend to use Cialis. It's got a lower side effect profile. And also Cialis has a formulation where you can take it every day. So rather than just taking the medication on demand, which is prior to sexual activity, you can take it every day. And that's got two very important advantages. Number one, it allows for spontaneity, right? If you take it every day, you don't have to time everything. It can be difficult to time sexual intercourse sometimes. And number two, if you take it every day, it's always increasing blood flow to the penis. So we talked about one of the problems with having diseased blood vessels in the penis is it's difficult to get blood to have an erection. But the second problem is when there's always lower blood flow, there's less nutrition to the penis, development of fibrosis. That's when you can deal with issues like having penile shortening, fibrosis, things like that. If you're taking the medication every day, there's more blood flow all the time, makes it ready for an erection, but also is providing more nutrition to the penis on a daily basis, and it reduces that risk of fibrosis and further damage to the penis, or at least, makes that a little less likely as well. So I tend to start with the daily Cialis, although there are multiple strategies to think about. These are nice because it often works, but it's not nice because it doesn't always work, right? These medications are not effective in some cases, particularly if the causes of erectile dysfunction are more advanced. If those blood vessels are starting to get more and more diseased, sometimes they get so hard that even these medications can't expand the blood vessels enough to allow for that blood flow. If you have a nerve issue or a hormonal issue, sometimes taking these medications can bypass those systems and force more blood to occur. But until you deal with that core problem, it may still be an issue. So this medication isn't always effective, but for many men, it can be. And so it is something that we often try once we've decided more about what the potential cause of the erectile dysfunction is. There can be some side effects: headaches, facial flushing, stomach issues, muscle pain, nasal congestion are some of the ones that are reported, but thankfully not super common, but something, of course, we've got to watch you very closely. These are some of the more common side effects. There are other ones that can be seen as well. So let's say the oral medications are not working well. Well, then we do have another option. It's called penile injection therapy. So the tablets are useful because you take the tablet and it promotes more blood flow to the penis, so it's ready there for erection. But there's a limit to how high that dose can be, right? If you take a tablet, that medicine is spreading all over the entire body, not just the penis. Side effects occur because it's exerting that same effect of forcing more blood to other areas. That's why you have facial flushing. There's more blood flow to the cheeks, for example. It's happening all over the body. So there's a limit to how much we can take. However, if we could deliver that medication directly to the penis itself, then you can use a much more potent formula. And if it stays in the penis, then it's not going to affect the rest of the body. That's where penile injection therapy comes in. In some ways, it's almost like a liquid Viagra. We prescribe a small vial of this medication. We draw it up. You draw it up. We teach the patient how to do it. Draw it up into a tiny syringe. It's like a hair-like needle. And then you inject it directly into the penis. It, of course, sounds outstandingly uncomfortable. Thankfully, however, it's not as bad as it sounds. The needle is like a hair-like needle, so it generally passes with minimal discomfort. Then you inject the medicine in the appropriate area. You can get a very strong erection as a result. It's nice because it often works. It's a very powerful formulation that can often be used. Onset of erection is quite quick. It's usually an average of 10 minutes, although it can vary a little bit. You get that erection quite quickly, so it's ready for you to go, and it's on demand. You do the injection, you move forward. But there are disadvantages. It's not a cure, right? It needs to be done every single time prior to sexual activity. If you use too much of the medicine, you'll get too strong of an erection, and that's not good. Too strong of an erection that will not go away, especially after 4 hours. That's known as a condition called priapism. That's not good because when blood is stuck in the penis for too long, especially for more than 4 hours, you're not getting any fresh blood. It's just old blood that's sitting there. And in some ways, that's almost like having a stroke of the penis. You're not getting new blood flow, and that starts to cause damage to the penis. That can have some pretty big consequences. Other people can feel some pain with the injections. Thankfully, that's not quite as common, but it is something to consider. If you are using the needle the wrong way, it can cause development of scar tissue in the penis, which can have other consequences, such as curvature, loss of length, things like that. So you really need to be trained in the proper way to do it. So penile injection therapy is a nice option for really advanced disease, but unfortunately, it's got its drawbacks as well. Another option is something called vacuum erection devices. This is nice because it's not a medicine. It's a device that you just purchase and you continue to use that same device. But it's got its disadvantages. The biggest issue, honestly, is that it's a little bit difficult to use, and some men don't find the result to be quite as good as they would like. Essentially, what this device is that it goes on the outside of the penis and it uses a suction power. It can either be a manual pump or an electric pump. There are different types of penile erection devices that are used. It'll suck blood into the penis. So it's pull it in using that vacuum effect. You then put a ring-like device at the base of the penis, and that'll hold the blood in place, and then you take everything off. Once that ring-like device is there, it should hold the blood in the penis for you, and then the erection can be used. It's a little bit difficult to use at first, but if men start to learn how to use it, it can become more successful. It does have some issues, like I mentioned. It's a little bit difficult to use. The erection won't be quite as warm because you're kind of pulling blood and it's being held there. there can be a little bit of inconsistencies in ejaculations, and sometimes that vacuum force just isn't good enough to get the type of erection that a man wants. But it is something that some men will use. They can do that with the oral medication sometime as a supplement, although we generally don't use it with the injection therapy. Insertable drugs are another option. I'm really not a big fan of these. These are medications that are delivered directly into the urethra. That's the tube that a man pees out of. And so it dissolves through the urethra and exerts an effect on the penile tissue. Same thing, it's trying to open up those blood vessels. It is nice because it's not quite as invasive as using a needle. Although I'll tell you, the men that I have that have used it find it to be more uncomfortable than the needle. The urethra, when something's rubbing on the inside, you can imagine that can be quite irritating for some men, both during it, but also afterwards. There can be burning with urination, aching in the penis, things like that. I have not found this to be a very popular option, but it is there. And we have many different types of treatment options because there are so many different types of men, and we can customize the treatment as appropriate. Penile implant is another great option for how to deal with this. So what if the oral medicines aren't working anymore? The injection therapy is not working, or maybe you just don't like the injection therapy. It's causing side effects. You don't like having to do it every single time, and you want to find something that's a more durable long-term solution that doesn't require medication every time. In that case, the penile prosthetic is a great option. So the way the penile prosthetic works is it's a device that's completely concealed within the body, and you're actually replacing the corpora cavernosa inside of the penis. So if you'll recall, when we were talking before, we talked about the corpora cavernosa essentially being two reservoirs, or almost like balloons that are inside of the penis. They fill up with blood, and when they're full, you get an erection, and when the blood goes away, those balloons get empty and it goes down. This is actually just that, where you're implanting two reservoirs or balloons that are on the inside of the penis, and they go across the entire penile shaft. Those remain empty. There's a small reservoir of fluid that's also kept inside the body, and then a small pump that's in the scrotum or in your sac. When you pump it, the erection goes up. When you deflate, it goes back down again. It's really a rather ingenious device. Works outstandingly well. How could it not, right? You're physically causing the erection to occur, and when you deflate, it goes back down again. All the parts are concealed, so no one really knows that you have one just by looking, although by feel, you would be able to feel that pump device in the scrotum, if you know where to look for it. And of course, in the penis, you should be able to feel it. That's the whole point of it, right? It should be able to fill, so you get a nice, strong erection. It's got its advantages, but of course, it's also got some disadvantages. The advantage, of course, is that it works. How could it not? The disadvantage is that it is a surgery. Anytime you have a surgery, there are some risks that are associated. Let me just see over here. I think the slides went away here. Sorry about that. There we go. Advantages, and of course some of the disadvantages. So the disadvantage, of course, it is a surgery, but thankfully it's a pretty quick surgery. It really only takes about 45 minutes to an hour to do the whole operation. It's a come and go surgery, so you go home the same day. We do give several weeks for allow everything to heal afterwards. But it is an operation, so you need to be aware of that. And there are always risks that are associated with an operation. There's a risk of bleeding. Risk of bleeding is outstandingly low, but something to consider. There's also a risk of infection. Anytime you use any sort of implant, whether it be a hip replacement, a knee replacement, or a penile implant, there's a small risk of infection. Thankfully, rates of infection are outstandingly low, but if that occurs, that's a big deal. So you need to have the proper technique and the proper preparation to reduce that risk as well. So why don't we go ahead and see how this works? We're going to go ahead and show a video so you can take a look and see how this implant works. So Coloplast is one of the companies that makes an implant. It makes a really nice device. It's the most rigid on the market, which is why I'm a big fan of it. The one that I like specifically is the one called the Titan. It's an inflatable penile device. What you'll see in the penis is first those two, right in the penis, you see those two balloons. Those are the cylinders Those are what are going to fill up with fluid. That blue device at the top, that's the reservoir of fluid. And then down in the scrotum, which is being grasped right now by the animated person, is the pump. That pump is then activated by squeezing on it. It moves the fluid from that reservoir that's also inside of the body into the cylinders that are in the penis. The erection is then ready to be used. You can then hit the deflate when you're done, squeeze the penis, and get all of that fluid out so the penis becomes flaccid once again. So pretty ingenious device in terms of how it works. You pump it out, goes up, hit deflate, goes back down again. Satisfaction rates are very high. The vast majority of men find a lot of good satisfaction with this. My patients also tend to find very high satisfaction rates, but I'm quite particular. At the end of the day, one of the things I always tell all men is that it's a great device, but no device will ever be as good as a natural erection, right? So we try the other options first. We try the oral medications. We try the vacuum erection device as appropriate. We try injection therapy as appropriate, because we really want to find a way to get a natural erection first, because nothing will ever match up to a natural erection, no man-made device. But if none of that is working, this is an awesome option for men. And we find that these men have great satisfaction because something is working and it's working reliably. So again, some of the advantages we talked about, completely concealed. We're going back here a little bit. So some of the advantages talked about, completely concealed, enhances some of the girth of the penis as you do it, a nice reliable erection. That erection stays up as long as you want. It really doesn't go away until you hit the deflate, and also generally covered by insurance. So these are all important things to know. This is another device that's in the slide deck. It's called a malleable penile prosthetic. I very, very rarely use this. This is a one-piece device, and I only use this in certain situations where a man's anatomy does not allow for that three-piece penile prosthetic. There's also a two-piece penile prosthetic that is available on the market as well. Again, not quite as good as that three-piece. That three-piece is the best one if you're going to get the maximum girth, you're going to get the most rigid erection, and really the best satisfaction rates. But certain anatomic variables, which are very rare to be very honest, can sometimes prohibit that three-piece, and that's where you might think about the two-piece or the malleable. Risks, we talked about some of these risks. Infection. Number 2, there's no turning back. Once you make this decision, you can't turn back and say, hey doc, take this out, let me try the pills again, which is why it's very important that you've tried everything ahead of time, because you can't turn back afterwards. Erosion and migration, just outstandingly rare. That's where the device could sometimes cause some damage within the penis. When it's properly placed, that is just an outstandingly rare thing to see. Chronic pain, outstandingly rare as well. Honestly, a lot of this has to do with proper placement. As long as it's placed in the proper area and appropriately sized, it's a very rare to have any of those risks that are listed. Device malfunction is actually inevitable, right? It's a man-made device. No man-made device will last forever. These devices do last for a long time. On average, they last for about 10 years. At 10 years, 85% are still functional. Beyond 10 years, you start to see a decline in some of the function. If and when that device stops working, maybe it's 10, 15 years down the road, a man has two options. He can often just leave it alone if there's no interest in sexual activity, or he can actually just replace the device. Replacement of the device is even quicker than the placement of the device, because a lot of that anatomy, those potential spaces have already been occurred. You essentially slip out the old device, slip in a new device, and you're good to go. Insurance coverage, as I alluded to, tend to be covered against most insurance plans, including Medicare. And it's important to know that this is a specialty, right? Not all urologists perform penile implants. You really want to find someone who's trained in it, does it very frequently, and feels comfortable to do it, because really getting in the right spot, choosing the right sizes, making sure you have the right technique is what's most important to make sure you have a good outcome, so the device is comfortable, works well for you, you have the lowest risk of complications. It's a little safety information that we're just kind of going through. So I just want to say thank you very much for attending. Hopefully this was helpful for you so you can learn a little bit more about erectile dysfunction treatment in general, some of the generalized, causes, which is very important to be aware of. Make sure that your physician is going through those causes because you want to go for that root cause and make sure this is managed as best as possible. And then, of course, the treatment options, whether it be tablets, vacuum erection devices, injection therapy, or an implant. There generally is one way or another that we can solve it. Not to mention, of course, dealing with those root causes, right? Lifestyle changes and things like that to make sure that it does not progress.